what they've been doing in Wales is slightly different to the rest of the UK, I think, isn't it? Uh, do you think it's a good thing or not?
I have significant concerns about telemedicine abortion, which is where a woman never sees a physician or a healthcare professional in person before obtaining an abortion. And I think there are two kinds of concerns that one would have to this. The first is safety concerns, because it eliminates the physical examination and ultrasound and so on. And also there are safeguarding concerns for particularly vulnerable women. An in-person private consultation with a healthcare provider is largely seen by most people, often including abortion providers, as the central safeguard against coerced abortion. And therefore, I think to remove it would put vulnerable women, victims of domestic abuse and human trafficking, at particular risk. And so I don't think is a wise move for women.
But we can't have everything in life governed by what is going to happen on very rare occasions, can we?
We can't, but we do say that when there's a substantial minority of people who are at risk, we should make significant sacrifices and changes in order to protect them. I think we've seen that most clearly with COVID, where it's only a minority of people who are at significant risk, but nevertheless, we take great steps to keep them safe.
But
What
I
I
think
would
we've
say is that
already.
it also, sorry, go on.
No, go on, you carry on.
I was just going to say it's actually not as uncommon as people would think as well. Studies show in Norway, a study showed that 25% of women having abortions were forced or pressured by their male partner. And in the UK, we have polling data, well, a survey suggesting that a fifth of women who have abortions have a forced abortion at some point in their life. So it is a minority, and I would never deny that, but it is a substantial minority.
But I don't actually, I don't understand how that is the case, because if a woman now wants to have an abortion, and if she finds out early enough, she can get the morning after pill, can't she? And then if that doesn't work, she goes to see her doctor. But surely, once you go to see your doctor, depending upon how far into your pregnancy you are, then a doctor should take the word of a woman. Quite often, a lot of women are forced to have a baby they don't want, as well as some women being forced to get rid of a child because of the bloke. But quite often it's the other way around, and a man gets very upset, and lots of men talk about this subject more than women. And if I was talking to a woman doctor today, she'd probably have a completely different take on this than you.
And also, if they are coerced, they'll just say to you, they just say the things that they're meant to say, aren't they, anyway? To get
Sure,
the
well,
abortion.
yeah. So the first thing I'd say in response to that, sorry.
No,
Yeah,
go
the
on.
first thing I response to that is that we actually have polling data from male and female GPs kind of disaggregated. And it does show that actually more female GPs are concerned about the possibility of coerced abortion via telemedicine than male GPs are. So the likelihood is if you were speaking to a female doctor, they would be more concerned than I am, statistically speaking. The other thing I'd say is that when we're talking about the possibility of coerced abortion, yes, it can still happen whatever the setup is. And coerced abortion sadly would always happen. But it's pretty widely agreed that the central safeguard that prevents a significant number of these is a private in-person consultation. I'll just read an example. This is Murray Stopes International, or MSI Reproductive Choices, FAQ section on their website, even to this day. On the FAQ, it says, "I'm being pressured into having an abortion. What should I do?" And it says the central reassurance that it gives to women is, "We will not provide treatment unless you are certain of your decision. As part of an abortion appointment, you would have a private consultation before treatment away from any person who has accompanied you to the clinic." So in clinic, it's very easy for the abortion providers to separate a woman from the man who has come with them in many cases. With telemedicine consultations, that's simply not possible. And we know that men can listen in at home and be out of camera shot and have a significantly greater influence on the woman.
But would you, I think personally the only person who should be involved in this is the woman. And I don't even think that men should be, if a woman has decided she wants to have an abortion, unless, they have a very loving relationship and they both want to come and see the doctor and explain they want to get this done as quickly and as efficiently and as carefully as they can, that's fine. But surely a lot of men who get really upset with a woman wanting to have an abortion, or whether they want to force a woman on an abortion, I suppose the thing the woman has to do is leave the bloke, but that's easier said than done, presumably, particularly if you've got children.
Yes. So we can have a different discussion about abortion more generally another day. I'd be more than happy to. I think what you said there is actually quite central to this, which is that this decision should be left to a woman herself. And the problem is, if she's getting abortion pills over the phone, usually not even via video consultation, there's simply no way to guarantee that it's her who's making that decision. Whereas if she goes in person, yes, it's still not absolutely guaranteed that it will be her making the decision, but it's much more likely because the provider can ask her, is this your decision? Is there anyone pressuring you?
She's just going to say yes, though, isn't she? She's just going to say yes, even if it isn't true, if she's coerced.
Well, I think that would, in some cases, yes. And like I said, this will never completely eliminate it, but I think it will significantly reduce it, because in other cases, a woman will say, actually, I am being pressured and I'd like to get some help. And I think we'd be undermining our health services and even the services of abortion providers if we said that they were completely incompetent at getting women support to make their own decisions through an in-person consultation.
I mean, one fact is, from talking about this over the years, is that abortion is still very difficult for a woman to obtain. There are so many people who complain, quite often women, quite often men, it has to be said, even demonstrations in this country to this day outside abortion clinics, which I think is the most appalling thing anybody can do. So there needs to be a way of making it easier for a woman who's decided, look, I'm not married, I don't want to have children, I'm pregnant, I want to stop this pregnancy as soon as possible. Do we make it easy enough for women in that situation?
I think what I'd say is that the law is extremely permissive by global standards and even by European standards. We have by far the most liberal law in Europe.
Well, we're not interested in the Europeans here, Calum. We don't really, we're not interested in what they do. They're messing themselves up in all kinds of ways. Never mind their vaccination program. But in this country, there's still quite a lot of a lot of contention around a woman being able to get an abortion. All sorts of people who, whether they have religious connotations or they're just sort of men who think they're superior, I'm not sure. But we need to make it easier and more acceptable for a woman who wants to have an abortion to have one, surely.
Well, the first thing I'd say in response to that is that sometimes we put things in place which make the process a bit longer or a bit more detailed, not as a way of making it difficult for patients to get the care that they want, but as a way of keeping them safe. So I work in general surgery. And before a patient has an operation, we make sure that they go through a very rigorous consent process. If they don't speak English, we get in a translator, which cannot be from the patient's family or their friends. All of this could be seen as an obstacle, but actually it's a way of keeping patients safe. And so ultimately, the best way to facilitate choice is not always to make things as smooth and convenient as possible. Sometimes the best way to uphold safety and choice is to put safeguards in place. And I think that's widely accepted across medicine and should be the same in the UK.
Okay. If somebody comes to you for an abortion, do you try more to change their mind than to facilitate them as quickly as you can?
So it's rare for a doctor in my position for someone to come and seek an abortion. It has happened. I have had to counsel women and talk about their options with them in certain contexts. What I like to do and what is my duty as a healthcare professional is to make sure that they're fully informed. I actually have had patients who have come to me after an abortion and say that they weren't fully informed. They weren't told that they could have significant mental health consequences, for example. They weren't told that the mental health literature shows quite clearly that there's an association between abortion and poorer mental health. And that association exists even when you account for all the other factors, the pre-existing factors. And so
you're basically against abortion. Is that on moral grounds as far as you're concerned, or religious grounds?
So for me personally, I think there are multiple reasons to think that abortion is not necessarily the best option for women. And this is something that abortion providers themselves have told me is the case in many cases.
And so do you, when a woman comes to you, do they know that you are primarily against abortion?
So we have a duty as medical professionals for those
No,
medical
answer the
professionals.
question, Callum. Do you make sure that they understand that you as a GP, as a doctor, not a GP, I beg your pardon, as a doctor, are against abortion? Do you make that point, that you are actually not in favour of somebody having an abortion?
So if it's relevant to the consultation, then yes, we have a duty according to the GMC to explain that we have a conscientious objection to providing it.
Well,
So I
isn't
would
that
do so.
anyone asking you, you should declare that, shouldn't you?
Yeah, I mean, if anyone wanted to know, I'd be happy to say, and it's not difficult to find out, and I'd be forthright with them. But I would also say that on clinical grounds, 98% of abortions in the UK are carried out on mental health grounds, and it's pretty widely
So you're
accepted
basically trying to
there's no-
talk somebody
there's no
out of an
clinical basis.
abortion before they get into your, you've decided to try and talk them out of it before you do anything else. And somebody may come to you and they don't want a child, doesn't fit into their lifestyle. They just want to get the abortion. They don't want to talk to you. Could you tell me when can I get this done? Can I get it done tomorrow? Surely a doctor should facilitate it when somebody wants to get this done as soon and as quickly as possible, and not say, well, we'd like to talk to any family members, we'd like to talk to the father, we'd like to do this, because I don't think that has any relevance. I think it's a woman's body, a woman's decision, and she should be allowed to make it.
Sure. Well, what the evidence suggests is that most women do want to talk about their options, and they want to be informed about what an abortion involves, the developmental status of the child, the potential risks and complications, and the potential benefits. And so any competent doctor, no matter their personal opinion on abortion, will go through all of that with them and explain to them their legal options. And when a patient has come to me seeking
When you say
abortion, I've done
legal
that.
options, what do you mean? You mean the length of time, the gestation period, or what?
So legally in the UK, it's permissible to get an abortion up to 24 weeks on mental health grounds, is 98% of abortions, or up to birth if the child has a disability or if the woman's life is at risk. And so, yeah, so when it fits those criteria, then it's legal for her to obtain an abortion. Obviously, if it doesn't, then it's not.
So if a woman comes to you and says, for argument's sake, she's 12 weeks pregnant,
Yeah.
what would I don't want to have a child, what would you do?
Well, the first thing we're always supposed to do as doctors, particularly with sensitive situations, and particularly in situations where coercion is common, is to ask questions about how she feels about
I'm not
the pregnancy.
asking about people who are being coerced, because it is a minority, as you've said. I'm asking about a person who comes to you, maybe a businesswoman, maybe something, who doesn't want to have a child, comes to you, says, I've missed 3 periods or whatever, I would like to have an abortion. Could you facilitate that as quickly as possible? Would you do that?
Yeah. Well, so as I say, we have both a clinical and a legal duty to ask questions to make sure that she fits the legal criteria and that it is clinically appropriate. If I didn't do that, I would be breaking the law. And so I have like I say, a clinical and a professional duty to ask questions and get a lot of detail. And that's not because I want to necessarily put an obstacle in front of a woman. As you say, most women will go on and have an abortion anyway once they've started to seek one. And there's no way that I could stop her from having one.
But you would try.
What I have a duty to do is to explain all the options to her, explain the evidence, and make sure that she fits the legal and clinical criteria, which, as I say, is actually quite questionable in many cases.
In what way?
As I suggested, 98% of abortions in the UK are done for mental health grounds, but actually it's pretty much universally conceded.
How could you prove that? Because I've never heard that figure. 98% of abortions are required by men. What is a mental health reason? Because somebody says, I can't cope with a child now. I don't want to have a child. I just want to stop this pregnancy. Is that a mental health issue?
Yeah, so, I mean, in English law,
Really?
it's broadly interpreted.
That's a mental health
yes,
issue, is it?
So
If you had your way, Callum, you wouldn't have anybody having an abortion unless it was endangering their life, would you?
Well, can I answer the first question about mental health there, given that you asked for the evidence?
Yep.
So the Department of Health and Social Care publishes statistics on this every year, and it says 98% of them are done for physical or mental health grounds. And of these, 99.8% are done specifically on mental health grounds. And specifically,
I'd like to see that. I'd like to see that, because I don't believe it. I don't believe it. I don't believe that the vast majority of, and if it is, then I would question what you consider to be mental health grounds. as I said before.
Well, exactly.
And
this
you're
is a
going to tell
significant-
somebody you don't think they're mentally stable enough to have an abortion when that's what they want.
Well, this is what I'm saying is that this is a very contentious area because according to the law, it has to fulfill a mental health criterion unless the child has a disability or the woman's life is at
What about
risk.
morning after
And
pill
therefore-
though, which within a couple of days, where you go to the chemist, is that still 98% mental health grounds that those are obtained?
So because that doesn't fall under the abortion law,
Right.
they don't collect statistics in the same way.
Right. I see, yeah.
Do you approve of morning after pills?
What I would say is that the evidence that we have, the systematic reviews, show that they don't do anything to reduce teen pregnancies or abortion rates or anything like that.
Well, they must.
I
do.
have
They
not.
must- they
Well, of
must
course
do.
they do.
How can they not do?
Well, the systematic reviews, whether it's from the Guttmacher Institute, whether it's a Cochrane
But that
review,
wasn't the
none of
question
them-
I asked you, Callum. The question I asked you was, do you approve of them?
So it's a complicated question because it
Well,
is.
no, it's not. You either do or you don't. It's an easy question.
Well, there are multiple kinds of morning after pill. So it really depends. Some of them are ulipristal, some of them are levonorgestrel, and they operate in different
So which
ways.
one would you
So for
prefer
those-
then?
So for those morning after pills, which is very unlikely that they operate once a new human life has begun, if it's likely that they operate.
When does the
after
human
that-
life begin, in your view, Callum?
So I don't have a personal opinion on this. I just follow what I was taught at medical school and what 95% of biologists say, which is at fertilization.
Oh, so as soon as the sperm has met the egg, that's when human life begins.
That's what the biology tells us. Yes.
Yeah, and that's your own personal view. Because many
It's
doctors
not
I've
a-
spoken to about this would disagree with you vehemently.
Well, for example, there was a research study by Steve Jacobs.
Because if
a
you
couple of
actually
years ago.
believe what you've just said, then you believe that abortion should never happen.
Well, as I said, there's a study from a couple of years ago from the University of Chicago which surveyed thousands of biologists, and 95% of them agreed that a new
Surveys can
human
say all sorts of things,
starts at
Callum, and I'm not
fertilization.
really interested in surveys. I'm interested in, medical practitioners who help people get what they want and those who don't. And it seems to me, you seem a very charming, very nice guy, but it seems to me you are very anti-abortion. So a woman would find it very difficult if coming to you to get one. And that would give her
Well-
mental health problems, if nothing else.
Well, surveys are important in academia because they are a kind of academic research. And if there's a survey of thousands of biologists and 95% of them agree, I think we would want our doctors to pay attention to that sort of survey.
I
And if a
don't think
doctor-
so
if
at
a
all.
doctor
I think doctors are fairly knowledgeable about these things. And if you were to go, presumably, to a Mary Stopes clinic, they would handle this thing with a lot more care and consideration for the woman involved than I seem to be getting from you. I mean, all I'm getting from you is obstacle after obstacle after obstacle. And now I know that you believe that human life begins at fertilization. I presume that abortion is something that is an anathema to you.
Well, I'm sorry to hear that you feel that way. And I would hope that in an ordinary consultation, it would not be very much like a radio interview, and there would be a much greater time to explore things in much greater detail. What I would say, though, is that I find the allegation.
We've been
of
talking
me
about
not-
this for 40 minutes. I don't think many consultations with a doctor would go on that long, to be honest.
Well, what I would say is that the evidence is pretty clear on this, that women who have abortions have poorer mental health outcomes than women who continue unwanted pregnancies. They have a higher suicide rate, a higher anxiety rate, higher alcohol and drug misuse rate. And I have had women in my own practice who have come to me after an abortion and who have said, I was not told about this. And the people who provided the abortion were not careful enough in actually exploring.
I'm sorry, but your figures are one-sided, mate. And if I was to talk to a pro-abortion doctor, I didn't know you had views one way or the other, but now I'm beginning to realize you do. If I was to talk to a doctor who worked at one of the clinics or somebody who worked at an abortion clinic, I'm sure they will bring facts and figures to bear that would prove completely opposite, because you're only talking about one side of the argument. And I think you're doing a disservice to women who do not see a child as part of their life, who wish to manage to get the pregnancy over and done with because they don't want to bring another life onto this overpopulated planet. and maybe they should be congratulated for making that decision. And people like you should probably butt out of these consultations if you've got this one-sided view. I mean, I
So the
don't
first
actually
thing
understand how anybody would come to you and want an abortion, because that's presumably not your speciality. So if you wanted an abortion, you would go somewhere where that was something they did regularly.
So if I could respond to that, the first thing I'd say is that this is not just a partisan view. The major latest review on the subject of abortion and mental health was published by David Ferguson, who is himself pro-choice, a professor of psychology, and he has published the research which is universally regarded to be the best quality research on this topic, and he is pro-choice. He found in that latest review that abortion is associated with poorer mental health outcomes. So this is not just a partisan, selective use of evidence. The second thing I'd say...
What you're hang on, never mind about that. Because what you're telling me is if a woman comes to you and wants an abortion, you are going to start questioning her, asking her if she's sure this is what she... You're not going to help her get what she says to you she wants. You know, there are all sorts of things you've thrown in the way today. Which, if I was a woman seeking an abortion, I'd be furious listening to you.
You can get depressed after, giving birth, can't you? It's quite a common...
Of course, well, you get depressed about all sorts of medical treatment.
And I suppose if you were looking to have an abortion, that might be even more... I don't know if it's been looked into, but that could be even more, could manifest even more so. If
I mean, some people sadly have had more than one abortion in their life. I've had a number. I remember interviewing one, and I asked her the question, has this affected you? She said, no, I just seem to be very fertile. I don't want the children. And I wasn't very keen on using contraception. So I'm afraid, sadly, over my life, over the last 25 years, I've had 4 abortions, but I'm fine. It could have been worse. I could have had children. I wouldn't have been a good mother, and I wouldn't have wanted to bring them into the world like this.
So actually, this is something that the research is even less controversial on, which is that having multiple abortions over a lifetime puts you at a significantly increased risk, particularly of anxiety. And I don't know of anyone who disputes that within the literature. Obviously, that's a very difficult and sad situation for someone to be in, where they have to go through a distressing...
Well, if you get an abortion quickly, it can be over and done with very quickly, and the person involved can get on with their life, can't they? Unless they're going to be guilt-tripped by people like you.
Well, so certainly having an abortion quicker does put one at less physical risks. However, as I suggested, doing something in the most easy, smooth way possible with no obstacles is not always the best thing to uphold even the patient's choice. As I suggested, when we consent...
Well, you just said, hang on, you just said, on the one hand, it's a lot safer to have an early abortion, and then you've gone into this diatribe about, but of course we want to talk to people and make them think about it, and then they've gone on a little longer than they wanted to.
So the first thing, again, I'd say is that the requirement for an in-person consultation does not significantly lengthen the length of time it takes to get an abortion in such a way as to put the woman at serious physical risk. What it does do, however, is put women at serious risk of being coerced into an abortion that they may not want. And that is universally regarded as a very serious human rights violation. And it's a thing that is, as I said,
nobody wants anybody to do anything that they don't want, but you're making it sound as if it is a very high percentage of women who are being coerced into an abortion. And I think
that report actually... I've got the end of it. It says there is suggestive evidence that abortion may be associated with small to moderate increases in risks of some mental health problems.
Exactly.
Well, you're going to have mental...
Right.
Any
small
sort of
to moderate
operation is going to give you
increases,
a little problem, isn't it, really?
Well, it's
I didn't feel so good after having a kidney removed for a while, but I've got over it now.
Well, as I say, it's a small to moderate risk, but a moderately increased risk of something that is life-changing is not a great way.
It's life-changing having a child, and you might decide
risk.
You don't want to do that.
It is, but as I say, the objective evidence demonstrates that it's riskier from a mental health perspective to have an abortion than to continue an unwanted pregnancy. That's just what the empirical evidence demonstrates.
So what would you be happy if a woman came to you and said, I've just missed one period, I need to be, and then you find that she's pregnant, would you give her an abortion straight away then?
as I say, as with any patient, especially in a topic that is as clinically significant and legally significant as this, my duty would be to find out much more from the patient first, to ask them questions, to ask them about their physical condition, about their mental health condition, about their relationships, and so on, and to check whether or not it fit the clinical and legal criteria. As with any
How many
patient, for any
abortions have you
procedure.
carried out?
I have not done any abortions.
Thank you very much indeed, Dr. David Calum. That is an actor. Dr. Calum Miller, thank you for that. I despair, really, if you have to go through all that and you want to have the chance of having a child taken away as soon as possible, then I suggest there. 0344 499 1000 back after this.